We are here to our live show STEMRX Beyond the Hopes, and today we are going to discuss the topic delayed development. To discuss the topic, we have Dr. Gauri with us. Welcome, Dr. Gauri, to our show.
Hello everyone.
So today we are going to discuss delayed development.
Yes.
So first question will be, what is delayed development?
Okay. Delayed development specifically has to be differentiated with the delayed milestone. Like what are the proper milestone kid has to gain as per their age, as per their month. It started getting delayed. Sometimes this delay can be at the mental status, or it can be up to at the physical status also. Sometimes this delay goes that much extent that kids started developing deformities in intellectual level, speech level, sometimes physical level, physical activities. So in all this condition, in all is taken as a delayed development. It can be neurological, it can be physical also.
So what is the difference between delayed development and delayed milestone?
Okay, in specifically in delayed milestone, sometimes kids gain those milestone little delay, means after some time they started getting those milestones. Like for example, some kids started walking at the age of 1 year or 10 month, 11 month, but some kids started walking at the age of 14 to 15 month.
Okay.
So that thing we can take it as a delayed milestone, that he has gained that milestone little delayed. But in delayed development conditions, it is been seen that kids takes very long time, like it takes sometimes years, or sometimes they form themselves some deformities that they are not able to gain that milestone.
Okay.
So this can be the difference between delayed milestone and delayed developments.
So what are the common signs? Means how we can say that the kid is suffering with delayed development?
Okay. Uh, Initially, sometimes in some cases it is seen that small milestones are little delayed, like turning on one side or sitting without support. This can be the physical issues, delayed developments. And in some kids it has been seen that their intellectual ability is little delayed, like their cognitive skill, uh, giving a social smiles, or in sometime they understanding small things when they become toddler. When toddlers are able to understand small reciprocation, cognitive skills are there. Those things started getting delayed. They do not reciprocate that good way to their parents, or they do not get mingled with other kids, or eye contact can be sometimes little avoided by the kids. It is being seen some kids are get difficult for them to mingle with other kids. They become a loner. They play alone at their some toys. They didn't get connected with other kids in the class.
Yeah.
And they don't speak, understand all the things, but they will do all the thing, all the things, all the requirements are being fulfilled by just pointing the things or pulling the parents to that thing to get me that done that thing. So avoiding to speak, avoiding to communicate, this can be the sign symptoms. In some grades where physical developments are on a higher extent, this can be seen when after a year or some kids sometimes develop any infection like meningitis or like that, and they develop convulsions, which also causes delay in development after that age.
Okay.
Yeah, because first 1 year 2 year kid was developing very fine. Due to some reason some changes comes up, and later on that age development get hampered. That can be mental, neurological, physical, anyways. According to the different causes, means whatever with the cause. It can be no idiopathic cause, it can be infection, fever, convulsions, anything can be cause.
Okay, then now we are seeing nowadays these cases are increasing. Why I want to ask you the question that why these incidences are increasing nowadays.
If we think nowadays why these things are increasing, our lifestyle is growing very fast.
Okay.
Yeah, because first of all there is our lifestyle is getting very shortcuts. Our nutrition, our food pattern is changed very much. We take improper nutrition. There are lots of junk food, fermented food, or the food pattern which has been cultivated is also not that level. That's why we are thinking nowadays about the organic things which has to be eaten, because all the fertilizers and chemicals which are being used in cultivating, so these factor also plays a major role in having such issues. Sometimes there can be a genetic problems. um, some genetic conditions are there which may lead you to cause delayed developments, and sometimes environmental factors are there. If parents are having some issues like older history of delayed development in some other kids are there, or older age of pregnancy is there, that can be the triggering factor in causing such type of condition.
So, when you are explaining us about the delayed milestone and delayed development, that time you said that delayed speech or delayed language are there. Why this happened?
Okay, there are two factors, like what is delayed speech and what is delayed language skill.
Yeah.
Okay, it is not important that if a kid is having delayed speech should have the delayed development.
Okay.
Sometimes his physical development is completely normal, but due to some pathological factors, he is not able to speak up any word. Then pathological factors can be sometimes lip tie, tongue tie can be there. That's why kid is not able to move his tongue properly, so he didn't speak. Sometimes there can be sensorial issues, gums
Yeah.
issues, sensitivity issues can be there. That's why also kid try to avoid speaking. Sometimes it has been seen in delayed development kids also that their hearing capacity is sometimes not affected, is not that good level, and it is very commonly seen that this doesn't get diagnosed that early.
Okay.
Because parent didn't understand that he may have some hearing issue. They think that he didn't speak. His all other behavior is okay, but he is not speaking or he is delayed speaking. Lots of time there can be hearing problems. It should be checked on time. It can be treated, and after treating that kid started developing, because he is not able to hear anything, so he is not able to learn anything.
Yeah.
Not grasping. So these things we can take it as a delayed speech and delayed language skill. Language skill means he is having sounds, he is making lots of sounds, lots of pronunciation, but not as per the language, whatever tongue he is going to speak, English, Hindi, whatever, French, whatever tongue he is going to speak, he is not able to unlearn or adapt or understand what has to be spoken in which way.
Okay.
This is taken as a poor language skill.
Language skills.
Yeah. So in this level, sometimes you can see intellectual issues comes up here. Delayed speech also sometimes comes with intellectual issues, and language skill is maximally related to the intellectual issues.
Okay.
So here when there is a language skill issue, then there comes the speech therapies, and lots of stimulations should be there, speech area stimulations, lots of trainings has to be needed, so that the kid should improve his learning capacity, intellectual capacity, and then he will be able to speak up.
So, we are talking about the kids who are suffering with delayed development, but parents also plays a vital role in
Yes.
that. And I need to ask you that how parents should take care of their kids.
Okay. In this cases, parents are the most suffered thing for
Yeah.
peoples, I can say, because kid is living his all the levels what he is able to do, but where the expectations are, and the, we can say, emotional connect when they find lacking with their kids, there
Yeah.
the problem comes up. So here I will advise parents that every time whenever you are going to be a parent or you are a parent, you just check out a um, small list of developments that how it has to be, learn the procedure, that what are the problems coming up with the kid, how the things are getting difficult for him to understand, to learn, or if there is any physical issues, get him diagnosed properly.
Okay.
Because the thing is, sometimes we have seen that parents are not ready to accept. They think that he will develop okay, they are not they have a fear or some expectations is different. Sometimes other people influence comes up that okay, just give him some time, he will develop. It's not like that. You should be open and free to talk to the professionals whatever you find that it is difficult with him, or what, any small point with parent find that this is not up till that mark which the other kids are having. You can point out, you can have a talk with the professional, clear out your doubts. If anything is there, it can be covered up with the help of investigation, evaluation, measurements and all. So that part is very important. And it's not like don't take the things on blamings, or lots of time it is being seen that parents are being blamed for such conditions and all. So you should keep your mind very much free of all these things.
Okay.
And be focused with your kid, be focused with what is the important part to be played in such condition, and work upon that.
So the parents are there with their kids for 24/7, and they are working with them. They are living with them for
Yes.
years and years. So they take care of kids, but what care parents should take of themselves?
Yes, most of time I feel that here more than a parents, extended family plays the major role of developing a proper environment in the family to support that couple in a better ways, so that they should get encouraged uh, to educate their kid, to develop their kid in a better ways. Nextly, for a parents, it is important that giving a proper time to the kid, proper quality time, because nowadays we see both the parents are working and kids are with the grandparents. It is good to be with the grandparents, but sometimes some educational skill, some time, quality times, reading time, play time, garden time is needed to the kid. It's not like if a kid is of delayed development, he is not able to understand the affection or emotions. He understands. He needs that quality time from the parents also. So that should be given to the kid. All these small parts play major role in their emotional and physical developments and metabolic developments also.
Yeah.
Nextly, parents should also focus on their nutritive levels, that which type of food you are giving, how the quality pattern of the food should be. All these things plays parents has to do whenever the kid they find that the kids are having issues with their understandings, delayed developments. If a kid is having some physical problems also, so there comes the major role of the parent, that they should focus for their physical activities, physical physios, physical rehabs, which has to be focused properly. And most important part here is that early intervention plays the major role. The max you do early, the response will be that fast, the
Okay.
recovery will be that fast, because early stage means first 5 years are the developing age actually. So maximum neuroplasticity of the brain in kids is seen in first 5 years. So if any changes, if any adaptability, if any improvement has to be come, if you start at this age, the development is very faster. All the kids which we treat at places, if they are below 6 or 7, their responses are very fast, very good, as compared to other kids also show responses, no doubt, but these kids come to the normal state at very fast conditions, and in a very positive way.
Yeah.
Stronger way. So I always advise parents that early intervention is the best way to go with anything, any treatment, any training, any physical conditions, everything.
So can parent take care of their kids with the help of experts?
Yes, definitely. In some cases, everything cannot be treated at home. Though you are giving time, affection, training, proper nutrition, but still professional care is needed in some cases. For proper guidance, so because everything cannot be learned by them. So you need the proper guidance, that how during the speech how the things has to go on, what should be the way parents should talk to the kids or play with the kids to get things stimulated better way. Then what way should be the rehab program goes on when there is a physical issues, physical deformities are there. So here professional support is needed.
So,
Okay.
this is not a new medical condition or clinical condition, we can say. It is conventional. Means from last many years we can see the kids having delayed development, but now we are diagnosed it as a delayed development. So, what are the conventional treatments for it?
Okay. There are lots of treatment available right now in the modern line of treatment for treating kids. Maximally are towards the functional medicine
Okay.
related to the ABA therapy, speech, and the things. Okay, but in regenerative medicine has also shown good response in such kids. All the kids which we have treated till now, they are under all the rehab programs and all. Whenever they go with the after the regenerative medicine treatment, the response to all these sessions has been faster.
Okay.
Because every kid with a delayed development comes to us, and he is already on all the rehab programs, speech therapies, and all the things. Uh, when when these sessions are being done, when these treatments are being done, their response are being enhanced.
Okay.
It has been speed up. It has their intellectual capacity has been improved to accept all those trainings.
Okay.
Their even physical disabilities are there, their power, muscle power, their deformities are also been improved in better ways after the treatment with the regenerative medicines.
Okay. So that the same question I'm going to ask you. What are the regenerative medicines?
Okay. Regenerative medicines are specific type of medical treatment pattern in which the deficient cells, the cells which are not being properly developed in the body, or which are not going as per their speed of the development, or which are being damaged due to any pathological condition, sometimes due to the trauma, sometimes due to any infections. So to regenerate those parts is called as, this form is called as a regenerative medicine. It
Okay.
have a capacity to regenerate every that different specific type of a cell or a functional part of that area to make it functional again, to start its activity, to start its normal behavior again. So regenerative medicine is has showing a dynamic level of changes in the patients. Whenever they go with that, their intellectual capacity improves, their sensory capacity get reduced, their language, their speech areas started getting developed by going with this. Then
Okay.
we had also seen that the patients with physical issues, spasticities, neurological conditions, um, we can say improper functional movements are deficient, so those started getting improved.
Okay.
And their intellectual levels get better, their understanding, their cognitive behavior started getting improved after that.
So, what are the opportunities? Again, I'm asking the same question. What are the opportunities of getting cured with the help of regenerative medicine?
Okay. As I told you, this helps us to speed up the development of the kids. It is been actually delayed. We don't want that kid should get up to the mark of reduce reversing.
Okay.
Or the fixation should happen, or it get difficult to get reversed back at that stage. So I lots of time say that early intervention is the best part. The most early, the best the results are there.
Okay.
Nextly, as you say, what are the opportunities? This will help the kid to be fast develop. Nextly, get accepted in the society very fast, because due to their behavior issues or physical deformities, it get difficult for them to get socialized with normal academic conditions, normal physical conditions. So this will help them to go to the normal academics level due to, because of their deficient intellectual capacity, they are not able to be accepted in the normal schools also. So this can be avoided. They will be able to attend and grasp the level of the normal kids.
Okay.
With the even with the physical issues kids are there, for them it will be easy for their daily livings day-to-day activities will be more easier without any support, without any help, if they are starting able to live their life. That is the best part. That is the best opportunity which we kids give to our kids to go with their lives.
So, as we are doing the show STEMRx Beyond Hopes, and we are working in STEMRx with regenerative medicine. So,
Yeah.
can STEMRx give the hope to the people that with the help of regenerative medicines, these kids can live their life normally?
Um, we can accept that kids physical and mental capacity to go up till that extent that they should able to adapt themselves in the society with the normal behavior.
Okay. So, with that hopes, we will end today's session of STEMRx Beyond Hopes. We will meet Dr. Gauri in next session with the next topic. Thank you very much, viewers. You can ask your questions in our comment box. We will definitely try to give your answers. Thank you very much.
Thank you.